What is Gynecomastia by Dr. Andrew Iraniha from Surgical Oasis Institute.
Hi guys, I'm Dr. Andrew Iraniha from Surgical Oasis Institute. I'm a board certified general surgeon who has been in practice for more than 2 decades in Southern California, Orange County. And I dedicated my practice to body contouring. And one of the common issues that I address in my practice is gynecomastia. And today I want to talk about gynecomastia, the definition, the symptoms, and also how we take care of and manage that. So gynecomastia is the enlargement of the breast tissue in men. And majority of times it has 2 peaks, one during the puberty and the other one at age 50 to 70 years old. And a majority of patients obviously come with asymmetry enlargement of the breast tissue, and that's very unsightly for them and make them very uncomfortable. Some patients present with pain and discomfort, and some people even present with nipple discharge, which is very uncommon. A lot of patients, especially older patients, the enlargement of the breast is also associated with a lot of extra fat in the chest, which basically decrease the definition of the chest wall on the male patients, and also create a sagging on the breast as well, which is again very unsightly and uncomfortable for the patients. The exact etiology of the gynecomastia is not very clear. However, the more common problem is hormonal imbalance. Essentially, the men also have estrogen as well as androgen, but there is a very balanced ratio normally for male gender, but if that balance changes and amount of estrogen goes higher or amount of androgen goes down, then you can create a gynecomastia or enlargement of the breast tissue in male patients. There are medication that taking those medications for a long time also can create the gynecomastia, including some of the antibiotics, anabolic steroid that some of the male patients use to get bigger muscles and with exercise. It's also associated with taking anti-anxiety and anti-depression medication. There are some of the diseases associated with gynecomastia, especially liver disease and some gonadal abnormality. Patients with aging and also during the puberty, some of the conditions that is associated with enlargement of the breast, and obesity and malnutrition also is associated with imbalance of the hormones in gynecomastia. Now let's talk about surgical management of the gynecomastia. It really depends on the intensity and extent of the gynecomastia. So again, some patients they just present with enlargement of the breast. They don't have any extra fat around it. They have a nice pec muscle shape, and they just worry about that bulge behind their breast tissue. And for example, in this patient, in a young patient that has a natural athletic body with a great form of the pec major, but unfortunately has evidence of gynecomastia. So the treatment of that patient is very simple. We make a small incision below the nipples on both sides and just remove and excise the extra enlarged breast tissue, and this is the final results after 3 months, and you can see it's absolutely normal on the profile. The breast tissue was completely bulging and very unsightly, and here is completely fixed. There are people that coming in with enlargement of the breast as well as extra fat in the upper body, and they don't have a good definition of the pec major. So then what we do is we also perform liposuction and liposculpture to give a pec major a good and natural form, as well as removing the breast tissue. There are people that coming in, not only they have extra fat, but also have sagging of the skin, and the nipple is completely displaced in the lower aspect, and is very unsightly. If you just remove the breast tissue, the final result will not be adequate. So in those patients, we basically perform a procedure called nipple lift, which we move the nipple slightly higher and do liposuction and liposculpture and remove the extra breast tissue, and to get a final good and aesthetically very nice and pleasant results. So if you are interested in having free consultations about the gynecomastia, please contact my office for free consultations at 949-646-8444. And please, if you like this talk, like my video, and so other people can enjoy, and also sign in with my channel in YouTube, so you can see more information about other aspects of my practice and other surgical problems that I address in my practice.